Welcome to how virtual reality is changing healthcare. Many of us are familiar with virtual reality. However, a few of us are unfamiliar with how virtual reality is being used in daily treatments in the healthcare industry. Another great example of how virtual reality helps in healthcare is the battling of the opioid crisis. Physicians today are exploring virtual reality technology as an alternative to prescriptions. The gateway control theory of pain, proposed by Dr. Melzack and Wall, suggests that a person may interpret pain stimuli differently depending on mental and emotional factors, such as attention paid to the pain and emotions associated with the pain and past experience of the pain. The immersive distraction of virtual reality can help the patient mentally transport to another space, which also positively affects the patient's emotional state. An example of this would be a trauma victim normally receiving opiates as during treatment would now be shown virtual reality of an environment created by nothing of ice, water, and snow. The complete opposite of the traumatic event in which led to the burns would shift the patient's mind away from the trauma being relived during treatment and also their current pain status. This is another way, again, that virtual reality is being successful versus supplementing the patient with opiates. Virtual reality is also aiding in complex surgeries. Virtual reality technology is allowing physicians and surgeons to practice prior to complex operations. Dr. Robert Lewis, the director at Hoag Neuroscience Institute, conducted a study which showed very senior citizens in different institutes were normally planning their surgeries based off of 2D MRIs. However, they were finding themselves redoing the planning after virtual reality was conducted and actually changed their surgical plan 24% of the time. The process of which a surgeon can go in and practice heart surgery before the actual surgery will lead to a vast majority of better health care for patients and faster recovery. Virtual reality is encouraging positive rehabilitation results. Patients traditionally seeking out physical therapy have now tried the new wave of rehabilitation. With virtual reality, it's allowing the patient to utilize data and learning processes in a real and virtual environment. With the immersive environment allowing and enabling the learning of movement strategies while simultaneously helping the patient unlearn the counterproductive older movement strategies. This has actually led to a better rehabilitation environment versus a hospital setting or an ambulatory practice setting when the environment is too hard to replicate. Now, with a better understanding of how virtual reality affects healthcare, the question is, will you choose virtual reality as your new treatment plan?